influenced the evolution of UriCap Female?
Thank you for that question. It's a very interesting question. When you start with a new concept, you don't know where it's going to take you. It's always like that. It's not until you go into the market and show it to the people that actually use it, and they come up with ideas. So we did come up with this female external catheter that we knew collected urine, and we started. And Sana was part of that, bringing that into the market, talking to the nurses, showing it off, and the first one was for this seminar. It was a nurse coming to Sana. Yeah, it's great. We can use it to collect a clean urine sample. So it's now used in hospital in Israel for collecting routinely for collecting urine samples. Secondly, when we go to shows and visit doctors, they say, "Well, we have a problem with children, pediatric." The small children, you put a catheter in a little girl, they have fever, they come in. We need to know that there is not a UTI. We need to have a differential diagnosis, and we need to get the sample so we can treat it quickly before you get a renal infection, a kidney infection. So we're actually starting a collaboration with a major hospital in Tel Aviv and their innovation group to expand and get a pediatric device that we can start getting urine samples from infant girls 0 to 3 years old. They are also incontinent, and you really need to collect the sample in a very non-invasive way there. That's a big one. And finally, we have another in England. They started selling it in Britain. We have a very great distributor there, and they came back to us and say, well, we would love to do flow measurement, urodynamic measurements. Here we can collect the urine, we can see the speed, but we want to direct it right into the cup where we can measure the time volume relationship on voiding. And so we have a request from there and using a longer tube just to do that. So you can see the UriCap as a platform that the market has, helped us expand, because the concept is there, and then you can apply the concept in many different ways. So it's a great way to be out there, and that really helps us developing a product for the patient, for the healthcare, for the nurses.